Hello everyone, I'm Dick Wolf with the County Buzz. We're going to be talking about blood this morning. We've got two guests from Blood Assurance. It's quite a wide organization that helps provide blood for patients and the like. And we'll talk with Vickie Shelton and Tony Seiber in just a moment. Whatever your shipping needs, Mr. Postman is where you want to go. Convenient across from the post office in Winchester. Take your packages or bring the item unpacked and they'll carefully box it and send it off for safe delivery. Anywhere. Yes, in or out of the USA, Mr. Postman can get it there quickly. There's more. Get a box number with a street address. Start a background check with safe and secure fingerprinting. Oh wait, forgot that card to go with that present? Not a problem. A good selection of cards, funny, faithful, and family. Mr. Postman, across from the post office, Winchester. Welcome back, everyone. I'm here with Vickie Shelton from Blood Assurance in Tullahoma and Tony Seiber.
Yes, sir.
Tony, tell us what role you play with Blood Assurance.
I'm the operations manager for the Cumberland region, and we have, in my Cumberland region, I have 3 facilities and 2 mobiles, and we go out to collect blood to take care of our hospitals as they need.
So by facilities, is that bricks and mortar?
Yes, we actually have standalone centers that people can come to 5 days a week and 1 Saturday a month and donate at any time from 9 o'clock to 5:30 every day.
Okay, so then you encompass, now you're the donor recruiter in Tullahoma.
I am. We work very closely together. I set up blood drives actually sometimes within our centers. We're happy to have a new center in Tullahoma, so we really want people to come in and see that beautiful new facility. And smaller groups that it may be harder to take a mobile to, or they don't have a place inside their facility for us to set up all of our equipment, we encourage them to come to our donor center. We'll have something special for them there, and they can have their own blood drive within our donor center. But I do set up blood drives in several different counties. We do so every day, either with a mobile or, as I stated before, an inside drive for these folks. We just need a lot of blood to keep all of our hospitals operating. In fact, we need 540 units per day, which is a lot of blood to keep our 72 hospitals supplied at the levels that are acceptable for their patient needs.
That's, I had no idea that the blood need was that great.
Yes, it is.
So how are we doing in reaching your goal of finding this blood?
Well, that's a very good question, because always that is really our goal and our emphasis every single day is getting donors in, and we use many different ways to do that. Of course, with all the social media out there that Blood Assurance, like everybody else, has their own Facebook page and Twitter, you name it, any kind of social media, we're out there. We're always asking people, telling people maybe what our blood supply level is that day. Could you please help us out, especially if you know you're a certain blood type. We just have many different marketing ploys to get to people every day, but mainly it's through the drives that we set up, and businesses, churches, large businesses, large manufacturing groups. Nissan, for example, in Winchester, in this county, is having a week-long drive. But we depend a lot on those coordinators that are in all of these areas to really help us to get the word out to their company members, to their church members, to their business community, whatever, to get people in. And this time of year can be a little dicey for us, because with the weather like it is, folks just don't want to get out. Even if they know a blood drive is planned at their office or something, they may just not get out in the weather to donate. So it gets tough. Between Christmas and wintertime, we do generally get into a critical need for blood. So
are we at that critical need
yes,
now?
we are.
We are. We try to keep at least a 2-day supply, and we are getting really low and getting close to being under that for I would say probably the last 2 weeks. So we are sometimes begging in order to get anyone out to donate, because if a family member, if it's your family member and there's an accident or some type of trauma, we need people to supply that blood, because without the donors, we don't have it.
Are you the sole source of blood for the 72 hospitals that you
Yes.
mentioned?
Yes,
We are.
And you say we're critical. We're within that 2-day window
Right.
as we speak.
Yes,
We
sir.
are.
So, yeah, we want to encourage people. You mentioned earlier that people don't even want to get out of their house, even if they've got a blood drive at their office. So you have a portable unit. You'll take it place to place to place.
Any business.
What is the bottom line on that? If there's 5 employees, do you come? If there's 25, do you come? What is the cutoff?
There's really no cutoff, because a lot of times I've had blood drives at a fairly small business, take a mobile there, and maybe they only have 25 employees, which generally all those 25 are certainly not going to donate. Not everybody, feels comfortable doing so. But they will call in family members. I mean, we'll just, call out all the stops and really have fairly good drives even at small places. But going back to small businesses, those are the ones that I would love to bring into our donor center if we could, rather than taking a mobile to them. We really like to make those mobiles lucrative. Truthfully, we would like to have 30 donors every time we take a mobile out.
Okay.
Anywhere. 30. We have one mobile that's actually smaller than the others. It's about the size of an airport shuttle. And 20 donors, 20 to 25 is good for them. But, to take a mobile around and get 8 here and 3 there, it's just not a wise marketing it's not a wise, move to do that. So we try to have larger drives.
When someone comes in, say a first-time donor, what sort of steps do you take to talk to that donor and say, we really need you every month to do this, or whatever the time period is?
You can only donate every 56 days.
56 days.
Yes.
That's
so,
the new.
So we try to schedule them in a follow-up appointment if at all possible, and we try to cater around their schedule. We try to make the hours as long as possible. We do the Saturday of a month, so we try to meet them and do whatever we can to make it convenient for them. And when they come in to the office for the first time, we just register them. They need an ID, a picture ID for the first time, to show who they are. We register them, then we do a physical, a mini physical. We check their iron. So it's always nice for people to eat high iron foods before they come for a couple of days to try to make sure their iron is to the right level. And then we take the donation, and we hope to make a great experience so they become a lifelong donor. Because less than 5% of people donate for all the population. So that's why blood is always in such demand, because you have less than 5% donating for everyone. So as you can see, that's pretty good.
The odds aren't good.
Right.
You're starting out on a downhill or an uphill slope, whatever the case. You mentioned a diet. If I'm going to give blood next Tuesday, what should I be eating between now and then?
Foods rich in iron, meats, green leafy vegetables.
Kale.
Kale.
Taking a
Spinach.
multivitamin works every day. There's just different things you can do.
And being well hydrated.
Right, and they eat a snack before they come, and drink, a significant amount of water, so they're hydrated, like Vickie said. But and we also have snacks and drinks in the facility before they donate. We'll give them one, and after they leave, we'll give them one before they leave to make sure they've had a good experience. Our facilities also draw platelets, which are used for cancer patients a lot.
I was going to talk about, and I'm going to have to look at this to pronounce it, but it's apheresis donations. Apheresis.
And that's for platelets.
Tell us about that.
After a person comes in, if you're a woman, you have to have a test first to make sure if you've ever had a child or been pregnant. And we do that test, and after that, and you're cleared, then you can come back in and you can donate every 2 weeks. And if you want to come every 2 weeks, that's great, but if you can just come once a month, we just try to schedule around your schedule as much as possible to be convenient. But those are a great need, because people, like I said, with cancer, and people that are pretty sick a lot of times need those platelets in order to go.
And so they take the blood out, but do you not also put it back in?
We only filter the part that we need, and we put the part that's not used back in. It's a closed system. You're not touching anybody else's products at all. So some people are concerned about the part that's going back in, but it's your personal fluids that are going back in. Plus we give a saline solution that goes in, and it's all medical grade, and it's a closed system, and after each person, all of that is discarded.
Is there a higher demand for these platelets than regular blood, or is
They're both very important, but the platelets are more important because we can get them faster. If we do the apheresis, then within 2 days they're with a patient. A patient is using them because they go to our Chattanooga office, and we have a lab that processes everything there, and they're sending them back out as soon as possible. And there are some days that we get down till that they just have a couple left on the shelf. So, this isn't like we have them stockpiled. We use them as fast as we get them. So that's why we're always in demand for those.
And I've got one other thing, and it's once again I have to refer to my notes. Double red cell Alex donation.
We don't do those in our facility here in Tullahoma, but we do them on a lot of the mobiles, and it's kind of the same situation as apheresis. It's just a different technique. And
But the blood comes out and you remove
filter.
something from it, and then
You
the
put-
blood
Right.
goes back
Yes, sir.
in.
Yes,
sir.
So there's a quicker recovery time, and
Right.
they can do this more frequently.
And
than,
many people that have that done, I mean, we kind of laugh, it's like having your oil changed or something. You know, you feel really
Yeah.
good. And a lot of people just giving 1 pint of blood, or whether they do an Alex or the apheresis, they just really talk about how good they feel after. And a lot of it is really psychological, because they know they've done such a wonderful thing for someone that's going to be the recipient. But they also just feel really good physically. So yeah, it's a great process. A lot of people just don't know that. So that's why we're always just trying to educate folks on the importance of blood donation, and also what it can do for you physically. And truthfully, a lot of people that have donated blood the first time, they didn't know what their blood type was. It's a great way to find out what your blood type is without having to pay $75 or whatever they charge at a lab. And also, some folks, I guess unfortunately, have found out that they have a medical condition that they didn't know about.
that you
But-
you find that in screening them.
Through screening, yes.
Yeah.
Through their blood donation. It all goes back to Chattanooga, as Tony mentioned, to our lab, and so it's very carefully processed there. And sometimes something will show up, and we have a doctor on staff, and she will be calling these folks to say, look, there's some abnormalities with your blood, and you need to see your internist as soon as you can. And people have found out about a bloodborne illness, or other issues by
So-
blood donation.
So Blood Assurance is collecting blood,
Right.
and so is this something that is whole blood through the entire process, or does it ever become a plasma, or
We make all products, and it depends what the need is then, but we have a lab in Chattanooga, like I said, and they process all of our blood products. The plasma and the red cells, I mean, they're all different uses, and we also have medications that they make from some of the blood products. So it's not just actual blood transfusions, it's many things.
blood medications? We'll talk about that in a minute. We're going to take a brief break, and we'll be right back with more right after this.
When it comes to furniture, appliances, electronics, and yard equipment, start with a company you can trust. Badcock Home Furniture and More in Winchester has spent years faithfully serving their community and their customers. Badcock Furniture has always been ahead of the rest when it comes to brand name furniture, appliances, and electronics. That's why Badcock is the best. Badcock continues to renovate their store plan with new top-of-the-line quality products that fit your taste and budget and make your life at home easier than ever. Upgrade your appliances today. Ranges, freezers, refrigerators, microwaves, vacuums, and stay comfortable through the years with air conditioners and infrared quartz fireplace heaters in several sizes and designs. Live healthy and sleep better with iComfort Sleep Systems by Serta, plus sleep accessories, support systems, and foundations from other major brands. Badcock carries state-of-the-art entertainment equipment, TVs, DVD players, home theaters, computers, tablets, printers, and more, and financing is available. Visit Gregor K. Gillum and the staff at Badcock Home Furniture and More today. 405 Bypass Road in Winchester. Call 931-962-4991. We make it easy. We deliver. Badcock Home Furniture and More in Winchester.
Welcome back, everyone. I'm here with our guests from Blood Assurance, Vickie Shelton and Tony. And you were saying that you make other things out of the blood. So every dot of blood that's donated gets used.
Right, nothing goes to waste. We take full advantage of everything. So when a person makes a donation, they can be 100% sure that everything is used to better someone's life and save their life.
Yeah, you've said two things before we went to the break that really struck me as not good. Number one, you're almost out of blood, so you're needing blood all the time.
Right.
Number two, you said only 5% of the people
Less than
are
5%.
donors, less than 5%.
Less than 5%.
Pardon me for bringing up WW2, but I'm of that generation, and in that era, virtually every able-bodied person gave blood because it was important for the war effort. What is Blood Assurance doing to try to get those numbers back up?
Well, Vickie, she's a recruiter, and she goes into our school systems, and we have something called a Court of Courage. And what that is a program that we have for high school students. And when they graduate, we actually give them a cord to put on their gown when they graduate. If they make so many donations in a year, is it a year or is it 4 years?
It's actually 2 years. You can donate for the first time with parental consent at age 16. So usually it's just a 2-year process for high school kids. But getting those high school kids in at an early age can make them lifelong donors. I know my daughter is one of those that gave for the first time at Tulum High School at age 16, and at age 31, she's helping set up blood drives in California, actually. So, you try to start them out at an early age, but like you said, years ago, because of the war and everybody was just felt that need to do it, we see that need come back several times. When there's been terrible things like the shootings in Chattanooga, I mean, people lined up. Over 1,000 people wanted to donate blood after that happened. And it seems like it almost takes, an incident of sorts to get people to really come out. So that's why myself and other recruiters and other marketing means are literally out there every day trying to encourage people, trying to educate people to get them back into that process. Because like you say, it's kind of fallen off the wagon, so to speak, since that era.
We want to be ready at all times, not just when a tragedy happens.
Right.
We want to be ready no matter what. And so our goal is to always have whatever products a hospital needs ready to go. And we try to maintain so many days supply. And like I said, we always try to keep at least 2 days, and we're getting short on that now. So that's why we're speaking with you and whoever can help us get the word out, how important it is to have that blood. And so we're ready no matter who it is. We're ready and we're waiting when the tragedy happens.
And well, I want to just briefly talk about tragedies that happen in these large events where huge amounts of blood are required. Do you partner with with national organizations in terms of global or national emergencies? Where all of a sudden a huge supply of blood is needed in Texas because they had this accident or something?
No, we really concentrate just on our area.
This is local.
Yes,
And blood assurance, this is such a compelling story, we kind of raced into it without talking about blood assurance. Tell us about blood assurance. This is a nonprofit company.
Nonprofit company. It started in 1974 at the request of Erlanger Hospital. It's a large hospital in Chattanooga, but they were having trouble keeping their supplies up, getting supplies from different suppliers, and anyway, they partnered together and blood assurance was created. The main office is still in Chattanooga. Very large operation there. But just over time, in that amount of time, which has been, 40 years, I guess, it's filtered out into many different areas. Right now, we cover an area from Johnson City, Tennessee, down into North Georgia, North Alabama, over to Columbia, up to Cookeville, Lebanon, Clarksville, Tullahoma. I mean, as you can see, that's a lot of mileage, that's a lot of land area to cover. And we went from that one hospital there at Erlanger to 72 hospitals that are supplied now. Yeah. And we're growing I almost want to say monthly. We're about ready to acquire 2 more hospitals.
So the hospitals are coming to you.
Right.
They are.
They invite us into the area. We don't just go into an area. The hospitals come to us because of our service and our products that they need. We are well known for taking care of our hospitals, always meeting their needs. And so they come to us, and when they do, then we go into the area. So we wait to be invited into an area. We just don't go out looking for new areas. We're happy to get those, but it's to our benefit, which has been wonderful that we have such a good reputation that people are coming to us.
Yeah, the hospitals. And now what we need to do is get people to you.
Yes,
and,
absolutely.
and
there's a lot of good people in the Winchester area. I do many blood drives here, but I'm always looking for more blood drives. Is anybody listening to our message and you have a business, you have a church, you have an organization?
Let's put a phone number underneath here for them to call.
Okay. I would just like for you to call my personal cell phone. My blood assurance cell phone would be the best thing. It's 931-247-1789. I'm Vickie Shelton, the donor recruiter. I can plug you into any area that you want to have a blood drive, and we can work with any group, business, organization, no matter how large or small. We can work with you. I know that I really appreciate the chamber in this town partnering it with us for many things and helping us out with some of our smaller drives and getting some activities going there to bring in more people.
Yeah, and the chamber will be helpful with that.
Right, they are. They've been very
business to business. But let's talk about your relationship with the public. What do you do if I'm home watching TV on a Saturday? How am I going to learn that blood assurance needs me?
Well, I'm not sure that you will on, on a Saturday like that. We don't do commercials on TV or that type
We're
of
not
thing.
for profit, so we don't.
We're
do
not,
those type
yeah,
of
so
things.
we
Yeah.
don't, right. We really depend.
But you talked about a golf tournament, I think is.
We
Yes.
are. We're planning a second annual golf tournament. It's going to be at Lakewood Country Club in Tullahoma. And I hope I have the date right. It's May 12th. There will be a lot of advertising through the chamber, through local access TV, many different areas this will be advertised on. But we will be using this money to go to the Blood Assurance Foundation that pays for scholarships, which I know we're going to talk about Crystal Green scholarships
Yes,
in
and
just a moment.
actually your timing is perfect.
Perfect.
Let's-
Okay, we had a good segue there, but
Yeah.
the golf tournament helps with that. This will be the second annual tournament that we've done. We're hoping to have about 22 teams. The first annual was last year when we opened our new donor center back in May of last year, and we had a golf tournament associated with that, and it was so successful. We're trying it again.
So excellent. Yeah.
Good.
Do you golf?
I don't.
Well,
No, I don't. I won't be planning that.
Well,
I will be there
We'll
all
be
day, but I
working.
will
We'll
not
be working it. So.
let's
Yes.
talk about Crystal Green. This is the memorial person whose name is being used with this scholarship.
Yes, her
I gather.
parents helped Blood Assurance several years ago. I'm not really sure of the date, the year, but it was a young lady that passed away with leukemia, but received a lot of blood products in her fight, and her parents wanted to honor her, and so Blood Assurance, of course, was happy to do that. But this scholarship is given to 12 high school seniors. It's a $1,500 scholarship. All of our high schools that we do blood drives with, their guidance counselors are very aware of the scholarship. And the criteria that they have to meet is have to be a student in good standing. I believe they have to have a certain grade point, and it's not really high, like a 2.5 even. But the deal is we want these children to be aware of blood donation, the importance to the community, and they have to set up on paper a marketing plan for a good blood drive and how it would bring in donors. So it goes through a committee. We have, hundreds every year that apply for this, and 12 receive it, and we're really happy to present these scholarships.
Oh, and
Crystal's
you're getting
memory.
a good bang for your buck too. And
You
you've got
bet.
some ideas.
You
to,
can't imagine the ideas that some of these bright high school students come up with, and we are really proud of our high schools. We do very well in all of the high schools that we do have blood drives, and getting ready to have a very large drive here at Franklin County High School in April. Suzanne Mitchell is our coordinator there, the host teacher, and I just want to give a shout out to her because I appreciate her so much. She gets those children in, she has them ready, and many of those students will become lifelong donors, which is certainly our goal.
All right. Well, this has it's been an eye opener for me. The eye opening part is the fact that we are short of blood,
Right.
and so probably in closing, Vickie, I'll ask you to address our listeners, our watchers, and tell them to come down and give a pint of blood. That it's or a pint. Is it a pint?
It is a pint.
Okay.
Yes.
It's
yes.
still a pint.
It's still a pint, and it's a very easy process. I know some people are really a little bit wary of donating blood, but I can't tell you the professionals that we have on our mobiles or in our donor centers. Really, if you've had a bee sting, that's a lot worse than what this feels like. And really, honestly, it's a fun process, and you will feel good, and you will feel like you've done so much for your community afterwards. But if anybody can get on our website each and every day, bloodassurance.org, check and see where there's a local mobile in your area. Go out and donate there. It would be so helpful. If you're in the Tullahoma area, we have a beautiful new donor center. It used to be Mike Niederhauser's China Gifts. It's now Blood Assurance next to Walgreens. We're open 9 to 5:30 Monday through Friday, every third Saturday, 9 to 1. Come by. You don't need an appointment. Just come on by, and we will be able to accommodate you, and we promise you really kind of a good time and a good feeling when you leave. But we are in a critical need, and anything that you can do. And if you can't donate yourself because of illness or other reasons, if you could get a friend to come out, just call anyone that you know that can come to one of our mobiles or one of our inside drives, or certainly to our donor center. We would appreciate it.
I couldn't have said that any better, and that's why I asked Vickie to say it. Thanks for watching. If you're seeing us on Comcast Channel 3, you can also check us out on YouTube or the Franklin County Buzz on our Facebook page. This is Dick Wolf for the County Buzz.